Assalamu alaikum. Another clinical station, musculoskeletal. This is 13 years old Anna who has difficulty in writing. So you do the hand examination. So just wash my hand, introduce myself, and taking permission, making some rapport, and looking doing the screening question and 3 screening question. You can follow the previous video of recording of GIA, the 3 screening question, and after the screening question looking from a far distance and looking for any dysmorphic face, any deformity, any dimension, any device present or not. And then we will ask for pulling the shirt up to the elbow joint, and then starting the movement. And we in this picture or during, because the opening statement is a hand examination, so we will do is very sensitive manner in head to toe inspection at a glance for any swelling, any asymmetry, any abnormal condition of the skin and the nail. And here then advice opening statement was hand examination. So when we will do the inspection and look, feel, move, we can see that there is swelling. So we will start from the look, feel, move and the function. So look, in this look there is a swollen of the metacarpopharyngeal joint, interpharyngeal joint, and proximal interpharyngeal joint and distal interpharyngeal joint, and maximum in the middle index and the ring finger, and there is also all the 4 the 5 digits is affected. And then we will with very sensitive manner after asking permission and telling that if anything make the pain please inform me and I will stop there. And then touching for the warm and this if there is tenderness, so I will avoid the looking for the pain. I will I will tell her to do the movement. So in this movement will be, can you make the star? When she will make the star, here I am looking for any psoriatic lesion, nail pitting is present or not. And on the palmar side, can you make a fist? I am looking for what is the condition of the thinner and the hypothinner muscle. And can you just touch your thumb with the index finger and then followed by others digit. I'm looking for the movement here. And after this will you please keep your hand just like this, and I'm looking for the tenderness of this joint. And after this, as this joint is tender, I will see the below the joint is tender or not. So I will tell her to I will check the wrist joint bilaterally, including the temperature, pain and movement. Wrist joint movement is flexion, extension, ulnar division and the radial division. And then to complete my examination, if there is time permits, I will because I will do the we are doing the look, feel, move and this function. I want with permission, I want to see the gripping of the child, how he grip or can he button and unbutton her cardigan. And so and if there is time permits, so to complete my examination I want to do the pickles of the upper limb and the pickles of the lower limb and the back. I want to see the gait to discover any other joint swelling present or not. And I want to do vital sign, anthropometry, tenor staging, hair, nail and skin survey for psoriatic lesion, nail pitting present or not. And I want to do the sleep depth examination. So present your case. So today I examined 13 years old. She has both metacarpal interpharyngeal, proximal and distal interpharyngeal joint of both hand is involved. This is swollen, movement is restricted, and wrist joint also involved, and there is psoriatic rash is present and nail pitting is present. So considering all, my provisional diagnosis is a case of psoriatic arthritis. It may be case of sepsis, maybe case of reactive arthritis, septic arthritis. It may be a case of ACLE, and it may be a case of systemic onset GI. There is rash with joint swelling is present. So how you manage this case? I will go through her previous record. I want to take the focus history and do investigation, basic diagnostic investigation. Anti-nuclear antibody may be present here, rheumatoid factor may be usually negative, and baseline investigation, full blood count with ESR, CRP, which will shows the disease activity, and renal function test, liver function test, and imaging X-ray of the affected joint, ultrasonography of this joint, and then treatment here, the treatment for the joint, treatment for the psoriasis, treatment for uveitis if present. So first of all, the treatment, active management and the long term management. Acute management for the pain, so rest of the joint, ice compression, elevation, and medication, NSAID, corticosteroid, disease modifying agent, biological agent, and for uveitis I will involve the ophthalmologist and dermatologist for psoriasis, and I want to go through the multidisciplinary team, pediatric rheumatologist, orthopedics, ophthalmologist, dermatologist, occupational therapy, physiotherapy, and liaise with hydrotherapy, liaise with school follow up. I want to give her the advice, and for long term management there may be hydrotherapy, passive movement, gentle exercise, splinting, and the advice may be counseling, the disease progression, side effects of medication, gentle exercise, steroid card, bracelet, avoid the crowd, avoid infection by preventing the crowded space, vaccination, avoid live vaccination when there is steroid is in high dose, and then the counseling regarding the compliance and adhesion to the multidisciplinary team. And what are the Vancouver criteria for diagnosis of psoriatic arthritis? Definitive psoriatic arthritis, when there is arthritis with typical psoriatic rash, and another is arthritis with 3 out of 4 of the criteria. This is the dactylitis, nail pitting, psoriasis like rash, and family history, first or second degree, have the relative of first or second degree relative of psoriasis. 2 skin and 2 nail, dactylitis and nail pitting, and psoriasis. If psoriasis is present, or if there is history of psoriasis in the first or second degree relatives, it may be counted. And the prognosis course may be relapsing and remitting with or without flaring of the skin disease. Thank you. Assalamu alaikum. And another thing is present the case. Today I examined 10 years old Anna, and she has bilateral swelling of the both bilateral interpharyngeal, proximal and distal interpharyngeal, metacarpopharyngeal joint. Movement is restricted, and functionally she was unable to button her cardigan. So this is how we can easily present within a very short period of time psoriatic, and on the skin survey there is a scale lesion and nail pitting is present. Okay, thank you.